My name is Dr. Andrew Williams. I'm the president of the Board of Health for St. Lawrence County, and I'm the Associate Chief Medical Officer for St. Lawrence Health Systems, and I'm the Chief Medical Officer for the Community Health Centers of the North Country. The main message that I would want to communicate to our North Country community is the importance of social distancing, making sure to stay home to avoid any unnecessary travel. And if you do have to interact at all with the public and go grocery shopping, to make sure that you're taking all the usual precautions, stay away from people at the supermarkets, maintain at least 6 feet of distance. If you have a mask, either a cloth mask, wear it, and to make sure to pay attention to hand washing, either with alcohol sanitizers or with soap and water for at least 20 seconds. I think the important thing for people to realize is that even though you may not get terribly ill from this disease, you don't know that ahead of time. We have people in the community who are young, otherwise healthy, who've become severely ill. So you don't know how you're going to respond. And even if you were to have a mild case, many people have a relative, a friend, somebody who's either elderly or who's medically vulnerable who could catch the disease from you. You have a mild case, they have a severe case, maybe they end up dying. So why not take these small preventative measures and help to prevent that tragedy? There's basically 4 patterns that I've noticed. We have the first group of people are people who are traveling from outside the community, who are coming from high transmission zones back to St. Lawrence County. Wow. The second group are people who, prior to the pause order, went to local restaurants and bars and then became infected from that. The third group, which is related to the first 2 groups, are people who brought the disease home to their family. And then the fourth group are people who are in groups 1, 2, and 3, and then went to work at either group homes or institutions. So those are the 4 very clear patterns of transmission that we've seen. And each of those patterns of transmission would be interrupted if people would continue to follow the guidance that we've put out there. So it's important to be skeptical. Everyone should be skeptical. The public should be skeptical. Medical providers should be skeptical of any news that they hear. They should look at resources they trust and make a judgment on their own. I would say, as somebody who's in the medical profession and who's a skeptic, this is clearly a real illness. We certainly see within the state hundreds of people dying every day. And unfortunately, it's affecting the medically vulnerable and the elderly, people who we really, I think as a community, as a society, should be working to protect. So it's important to be skeptical, but it's also important not to be foolish. I think it's important to remember that, like many difficult things, this too shall pass. There's already some signs coming out of New York City and other parts of New York State that the illness seems to be decreasing, the rate of illness seems to be decreasing a little bit. There's reason to believe the measures that we've taken in terms of social distancing and reducing unnecessary travel are having a positive impact. So I think if we can sort of stick to this approach in the weeks and months to come, we're gonna see some significant improvement and hopefully a gradual return to normal.